Hi, good evening. Welcome to Friday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. Initially, I would like to congratulate each and every students who have completed, or I can say who have cleared your OET exam. So once again, congratulations everyone. And today in this video, I'll be dealing with, as per this caption itself, I'll be dealing with, it's kind of a last minute preparation for your exam. So please do watch this live segment till the end. All right. And for the students who cannot, complete your OET exam or who couldn't crack this particular exam, don't worry about it. നിങ്ങൾക്കിപ്പോൾ അത് കംപ്ലീറ്റ് ചെയ്യാൻ പറ്റിയില്ല എന്നുണ്ടെങ്കിൽ don't worry about it, because see, as we know that everything happens for a reason, right? എല്ലാം സംഭവിക്കുന്നതിനൊരു കാരണമുണ്ട് അല്ലേ? So definitely don't lose hope. Next time definitely you can crack this. Okay, so please do continue your preparations and your hard work. Everything will pay off. So please do practice your materials as well as do more, take more effort so that definitely you can crack this exam. All right, yes. So as usual, I'll show you a sample question from part B today. Plus the sample question, I would like to explain about what are the tips and tricks that you need for your exam, because as you know, tomorrow we have exam, right? So for the students who are just preparing for your exam, for the next exam, maybe December 7th or something, you have an exam. So continue preparation. And for the students who are going to write your exam tomorrow, please do, you don't have to do anything special this day or today. Just relax and just recollect everything you have studied. നിങ്ങൾ പഠിച്ച കാര്യങ്ങളൊക്കെ ഒന്ന് recollect ചെയ്യുക, just revise everything, and please be calm and write your exam well. Clear? Yes. So I'll show you the sample question from part B. Then I will discuss about part B in detail. What are the important things that you have to focus on. So I'll give you 2 minutes for the completion of this question. So please do this question. Then we will discuss the answers. Yes, welcome back. Hi, good evening. So once again, good evening. Hi, Bula, good evening. Fasila, good evening. Shari, good evening. Drishya, good evening. Jilmi, good evening. So good evening. Yeah. So have you all done this question? It's all about, as I already mentioned, this is a sample question from part B. And I'll just give you some tips and tricks today for completion or for the completion of part B. I mean, the questions from part B. When you get the material for part B and C, and we know that there is no separate time for doing part B and part C. Together you will get 45 minutes, right? So reading as a module, this is a 1 hour exam. ഒരു മണിക്കൂർ exam ആണ്. And when you get the material, what is the first thing that you will do? നമ്മൾ ആദ്യം തന്നെ ചെയ്യുന്ന കാര്യം എന്താണെന്ന് കമൻറ്റ് ചെയ്യാമോ? Could you please comment it here? When you get the reading material, what is the first thing that you will do? For example, you guys are sitting in an exam hall, and when you get the material, that what is the first thing that you will do? Hi Jilmi, good evening. Yes, Jilmi, tell me. What is the first thing that you will do? നമ്മൾ ആദ്യം തന്നെ ചെയ്യുന്ന കാര്യം എന്തായിരിക്കും? When you get the material, what you will do first? Just imagine. See, tomorrow is your exam, naal exam aanu. So definitely you can just imagine certain things, right? Yes. So when you are in this exam hall or when you are in the exam hall, what is the first thing that you will do when you get the material? I mean, reading material. എന്തായിരിക്കും നിങ്ങൾ ആദ്യം ചെയ്യുന്നത്? First of all, you guys will just search for the questions, right? എന്താ questions എന്നൊക്കെ നോക്കുമോ? What you will do first? ഒന്ന് പറഞ്ഞേ. First, you will get part A. I know that, and you guys know that. Yeah. So, what you will do for the first time? എന്ത് ചെയ്യും? നമ്മൾ ആദ്യം തന്നെ നിങ്ങൾ എന്ത് ചെയ്യും? Yes. We need blessings, right? When you do whatever you are doing, so we need blessings. So, collect blessings. You can just pray yourself. Pray and just relax yourself, calm yourself. For that, you can take a second. Okay. Then just pray and take the material. Okay, നന്നായിട്ട് പ്രാർത്ഥിച്ചിട്ട് മെറ്റീരിയൽ എടുക്കുക. And when you take the material, what is important? So first of all, it will be part A. അത് part A ആയിരിക്കും നമ്മൾ ആദ്യം തന്നെ കയ്യിൽ കിട്ടുന്നത് അല്ലേ? And as I already informed, this module is actually 1 hour exam, and within this 1 hour, we have to finish 3 different parts. നമ്മൾ 3 different parts ആണ് complete ചെയ്യുക. Part A, Part B, and Part C. Okay, so actually Part A, other than Part A, we have Part B and Part C. You will get this material together, Part B and Part C. So, simply you can say 2 parts. But still, Part A, Part B, Part C. And for the completion of Part A, what is the time? എത്ര മിനിറ്റ് നമുക്ക് കിട്ടുന്നത് for the completion of Part A? For the completion of Part A, you can take 15 minutes. Exactly 15 minutes. 15 മിനിറ്റ് കൂടുതൽ നമുക്ക് എടുക്കാൻ പറ്റില്ല. So, take 15 minutes for the completion of Part A. When I say completion of Part A, that means you have to read 4 different texts. So, I'll give you a summary of Part A. In Part A, first of all, why we are doing Part A? എന്തിനാണ് Part A ചെയ്യുന്നത്? അല്ലെങ്കിൽ what is the importance of doing Part A in reading module? When you give or when you do Part A, this Part A is going to analyze whether this aspirant or whether the student is able to complete a certain task within a period of time. തന്നിരിക്കുന്ന സമയത്തിനുള്ളിൽ തന്നിരിക്കുന്ന കാര്യങ്ങൾ ചെയ്ത് തീർക്കാൻ ഈ ആസ്പിറൻറ്റ് ഏബിൾ ആണോ, അതിനുള്ള എബിലിറ്റി ഉണ്ടോ? So that is what Part A is going to analyze. For that, they will give you 4 different texts. 4 different texts ആണ് തരാം. Text A, B, C, as well as text D. And when you read or when you complete reading text A, B, C, and D, there you have a set of questions. അത് കഴിഞ്ഞ് പിന്നെ ഒരു set of questions ഉണ്ടാവും. I can say total 20 questions. 20 questions ആയിരിക്കും അവർ ചോദിക്കുക. Clear? So 20 questions will be there. 4 different texts will be there. 4 different texts, 20 questions ഉണ്ടാവും. And when you do certain things, ഇപ്പം exam clear ചെയ്യാൻ പറ്റില്ല അല്ലേ? You couldn't complete or you couldn't finish your exam properly, or you couldn't clear this exam, and you guys are thinking, why I've tried a lot, I have put a lot of hard work, and then why I couldn't complete or finish this exam, clear this exam. എന്തുകൊണ്ട് എനിക്കത് ഫിനിഷ് ചെയ്യാൻ പറ്റില്ല, അല്ലെങ്കിൽ എന്തുകൊണ്ട് ടൈമിനുള്ളിൽ എനിക്കത് കംപ്ലീറ്റ് ചെയ്യാൻ പറ്റില്ല, എന്തുകൊണ്ട് എനിക്ക് എക്സാം ക്ലിയർ ചെയ്യാൻ പറ്റില്ല? Just think about your mistakes. ഓക്കെ നമ്മുടെ സൈഡിൽ നിന്ന് വന്ന് ഓക്കെ ഐ പുട്ട് എ ലോട്ട് ഓഫ് എഫേർട്ട്, ഞാൻ ഒരുപാട് എഫേർട്ട് ഇട്ടിട്ടുണ്ട്, ഓക്കെ ഓൾ റൈറ്റ്. ആൻഡ് ഐ നോ അബൌട്ട് ദ ടൈം മാനേജ്മെൻറ്റ് ആൻഡ് ഇറ്റ് വാസ് ഓക്കെ. ടൈം മാനേജ്മെൻ്റ് ഒക്കെ ഞാൻ പക്കയായിട്ട് ചെയ്തിട്ടുണ്ട്. ബട്ട് സ്റ്റിൽ ഐ കുഡൻറ്റ് ഫിനിഷ് ഓർ ഐ കുഡൻറ്റ് ക്ലിയർ ദിസ് എക്സാം. എനിക്കത് കംപ്ലീറ്റ് ചെയ്യാൻ കഴിഞ്ഞില്ല, അല്ലെങ്കിൽ എനിക്കത് ക്ലിയർ ചെയ്യാൻ കഴിഞ്ഞില്ല. വാട്ട് ഈസ് ദ റീസൺ? ജസ്റ്റ് തിങ്ക്. ഓക്കെ, നമ്മൾ തന്നെ ഒന്ന് ചിന്തിച്ച് നോക്കുക. വെൻ യു ആർ ഇൻ എ വെരി പീസ്ഫുൾ ആൻഡ് കാം സിറ്റുവേഷൻ യു ക്യാൻ തിങ്ക് അബൌട്ട് ഇറ്റ്. ഓക്കെ, വൈ? വാട്ട് ഈസ് ദ റീസൺ ബിഹൈൻഡ് ഇറ്റ്? എവിടെയാണ് നമുക്ക് തെറ്റ് പറ്റിയത്? വേർ ഇസ് ദ മിസ്റ്റേക്ക്? വേർ ഇസ് ദ മിസ്റ്റേക്ക്? ക്ലിയർ? Then, the mistake which I can see from you is maybe you have taken a lot of effort for this exam. You have spent a lot of time. You have, the time and energy you have put in. It is so strong, I know that. But where is the mistake? എവിടെയാണ് തെറ്റ് പറ്റിയത്? It's all about the strategy. Clear? It's all about the strategy you guys are doing. And then you are thinking about, okay, we have or we know the strategy which you have given, and we are doing skimming and scanning method for part A and elimination method for part B as well as same for part C. Then why? Again, you know the strategy, but still you have no idea how to do or how to apply the strategy into this topic. ഇത് എങ്ങനെ അപ്ലൈ ചെയ്യണം എന്നുള്ളത് ഇപ്പോഴും നിങ്ങൾക്ക് അറിയില്ല. That is the problem. I hope it is clear for you. So today in this video, for those students who are going to write this exam tomorrow, I'll give you a last minute preparation for your exam. Plus, those who are like, ഭയങ്കര സങ്കടപ്പെട്ടിരിക്കുന്നവർക്ക് വേണ്ടിയിട്ട്, for those who cannot or couldn't clear this exam, this is for you. This video is for you. Clear? So you can just understand what or how can we apply the strategy into this materials. Clear? Yes. Yeah. Hi Pravida, good evening. Yes Pravida. Yes, Beulah, you will pray, right? Very good, dear. Hi, Arya, good evening. So, yes, coming back to this particular question. And, I was talking about part A, right? Yes, I forgot it. Anyway, so what strategy we are using in part A? We are using the strategy called skimming and scanning method. And what is skimming and scanning? That, that is, you guys know that what is skimming and scanning. Skimming, which means fast reading, and scanning, which means underlining important words from the text. As I already informed, we have 4 different texts. Clear? And the problem is that I've found majority of the students, they know this method, still they're not doing it correctly. Not doing it, precisely. Why? നിങ്ങൾക്കത് അറിയാമെങ്കിലും അത് കറക്റ്റായിട്ട് ചെയ്യാത്ത ഒരുപാട് സ്റ്റുഡൻസ് ഉണ്ട്. I know that. Clear? So, what you can do is, take a material. For example, take part A. And fast read part A. As much as you can fast read the 4 different texts. And when you read, take a pen and underline the important keywords, or take a pencil, underline important keywords. That means important words from A, B, C and D. Please do it. Otherwise, you cannot finish part A within 15 minutes of time. You couldn't, I can very clearly, I can say you cannot clear this exam if you're not doing these things properly. Clear? So, take a pencil, fast read text A, B, C and D, underline the important keywords from the text. I'll show you. And what is the next thing you can do? You can read the question. Question നമ്മൾ നന്നായിട്ട് വായിക്കുക. Okay, so when you read the question also, underline important words from the question. And still majority of the students, you have no idea how to underline the keywords from the question. Why? ഇപ്പോഴും കീവേഡ്സ് എങ്ങനെ അണ്ടർലൈൻ ചെയ്യണമെന്ന് അറിയില്ല. യു നോ ദാറ്റ് ഓക്കെ വി ഹാവ് ടു അണ്ടർലൈൻ സർട്ടൻ കീവേഡ്സ് ഓർ വേർഡ്സ് ഫ്രം ദ ക്വസ്റ്റ്യൻ, ബട്ട് സ്റ്റിൽ യു ഹാവ് നോ ഐഡിയ വാട്ട് ആർ ദ ഇമ്പോർട്ടൻറ്റ് കീവേഡ്സ് ദറ്റ് ഐ ഷുഡ് അണ്ടർലൈൻ. ഞാൻ എന്ത് വേർഡ്സ് അണ്ടർലൈൻ ചെയ്യുക? ആൻഡ് വാട്ട് യു മീൻ ബൈ ഇമ്പോർട്ടൻറ്റ് വേർഡ്സ്? I'll tell you. I'll show you actually. Clear? Then, and after that, you can understand the question and just think about, okay, where is it mentioned? Then you can write down your answer there. So likewise, when you practice it for a period of time, for at least 1 week, definitely you can finish part A within 8 minutes of time. That's my promise. Clear? നമ്മൾ ചെയ്യേണ്ട കാര്യങ്ങൾ നമ്മൾ കറക്റ്റായിട്ട് ചെയ്യുന്നില്ല എന്നുണ്ടെങ്കിൽ അവസാനം നമ്മൾ പറയുകയാണ്, ഓക്കെ ഐ ഹവ് ടേക്കൺ എ ലോട്ട് ഓഫ് എഫേർട്ട്, ഐ ഹവ് ഡൺ എ ലോട്ട് ഓഫ് ഹാർഡ് വർക്ക്, ദെൻ വൈ ഐ കുഡൻറ്റ് ക്ലിയർ ദിസ് എക്സാം? ബിക്കോസ് ഇറ്റ്സ് നോട്ട്, നമ്മൾ അങ്ങനെ ചെയ്തിട്ടില്ല. Clear? Yeah. So what about part B? And when you take part B, and as you guys know, part B and part C together you will get 45 minutes. So when you divide this 45 minutes into 2 sessions, you cannot, exactly divide it into half. But because in part B only you have 6 questions to face. Ninkaga 6 questions ullu. So there you will get maximum, you can take 12 minutes for the completion of part B. Or maximum 12 minutes edutittu questions complete here. Clear? For the completion of this, you can take 12 minutes. 12 minutes for the completion of part B. Yeah. Okay, so how many questions in part B? 6 questions in part B. And you will get 12 minutes for the completion of this 6 questions in part B. Then, what about the type of questions? In the type of questions, you have multiple choice questions with 3 answer options. Kanda, or a question they will ask you a question and they will give you 3 answer options for the question, same question, and then they will give you a particular paragraph for that. So what your task is, or what you have to do is, you can read the question, then you can understand the question, then read the options and read the paragraph, find out the correct answer. That is what you have to do. Clear? Adana nammal cheyendadu. And when I just say this in a correct proper order, I can say that when you get the material for part B and C, take part B material. We will part B material edukunu. And then what you will do? What you can do? Read the question. First of all, read the question. Question nannayittu vaikka. Second thing, underline the important words from the question. Question enna ningalku important aanu ennu thonunna keywords ningal orappaittu underline cheyanam. You have to underline what are the important keywords from the question. For example, I'll show you what are the important keywords which I found important from the question. For example, according to this memo, or according to the memo, staff requiring a free flu vaccination must. This is a question, a little bit lengthy question. And you know that you have to underline certain keywords from the question or important words from the question, and it shouldn't be more than 3. 3 കൂടുതൽ words നമ്മൾ underline ചെയ്യണ്ട. Clear? And when you underline the keywords from the question, it should be important. And those keywords can help you to find out the answer. That's in our mind. Okay, these keywords konde enikku ende answer kittum. I will get this answer from these keywords. So, what are the key important words here? I'm just marking memo. So, my first keyword from the question is memo. Another keyword from the question, so staff requiring a free flu vaccination must. So my another keyword is staff and vaccination. These are my keywords from the question. So I know that, okay, this is a memo. So what is a memo? And in part B, now you know what is the type of questions which you have or which you have to face. Multiple choice questions with 3 answer options. And what is the strategy we are going to apply here? നമ്മൾ എന്ത് മെത്തേഡാണ് ഇവിടെ അപ്ലൈ ചെയ്യാൻ പോകുന്നത്? We are going to apply elimination strategy or elimination method. What is elimination method? But before knowing elimination method, it is very crucial, or it is very vital to understand what are the categories of questions that you are going to face in your exam. നാളത്തെ ഇപ്പോൾ എക്സാമിന്, for example, in tomorrow's exam, what are the categories of questions that you will face in part B? Part B, നിങ്ങൾ എന്ത് categories of questions ആയിരിക്കും face ചെയ്യുക. And there you will meet 3 categories of questions. 3 categories of questions ആയിരിക്കും ഉണ്ടായിരിക്കുക. First category I can say that will be a guideline. So what is a guideline? എന്താണ് guideline എന്ന് പറഞ്ഞാൽ? Guideline which means, see, why I'm saying this continuously, because it is very important. You have to know about what are these 3 categories. Then definitely, trust me, you will get 6 out of 6 for this part B session. Clear? So yes, first category, guideline. So what are guidelines, or what is a guideline? And I can say that a guideline, which means it's a set of rules and regulations or principles or instructions that someone should follow. For example, I am a staff. I'm a nurse. I'm working in such kind of a hospital, yeah, whatever. ABC. According to this ABC hospital, I have to follow a certain kind of, some recommendations or instructions or principles that they have provided. അവർ തന്നിരിക്കുന്ന ഒരുപാട് കാര്യങ്ങൾ എനിക്ക് ഫോളോ ചെയ്യേണ്ടതായിട്ട് വരും, because those are my responsibilities to follow. Clear? So those are guidelines. Adana guidelines. Then in a guideline you can see a lot of words like have to. പിന്നെ എന്തൊക്കെ വേർഡ്സ് ഉണ്ടാവും? ഹാവ് ടു എന്ന് പറയുന്നൊരു വേർഡ് കാണാൻ പറ്റും. ഹാവ് ടു, ദെൻ ഷുഡ്, മസ്റ്റ്, ദെൻ അധിയർ, എബൈഡ്. സോ ഇതുപോലത്തെ കുറേ, ആൻഡ് ഇമ്പോർട്ടൻറ്റ്, വൈറ്റൽ. So idupolathe you can see a lot of words which indicate compulsory element you can see in guidelines. All right, then what are you reading for in a guideline? Nammal endine vendiyanu oru guideline vaayikkunnathu? If you get a guideline, what are you reading for in a guideline? To know what are the important instructions mentioned there, right? Alle adinu vendiyalla vaayikkunne. So I can simply say we are reading for the details. Endine vendiya vaayikkunnathu? We are reading for the details. Yes Fasila, endine vendiya nammal guideline vaayikkunne? We are reading for the details. Clear? So that's all about a guideline. Then which sentence is important in a guideline? See, actually each and every sentence they have mentioned is very important, but when you read a guideline I can say the first sentence is little bit more important. First sentence eppoഴും കുറച്ച് important ആയിരിക്കും, but because that first sentence will indicate okay what is the overall idea or details about this particular guideline. So first sentence is important. Clear? That's all about the first category. And I'm coming to the second category. So what do you mean by second category? In second category we have manual, policy. Two documents are namukkullathu. First one is manual, second one is policy. And what is a manual? Manual endada? So manual, which means it looks like a booklet, or booklet pole irukku, and it will be like an extract, okay, whatever. And it will give you an information about a particular machine, or a machine ne pattiyo. An instrument, or instrument in a patio. An equipment, or equipment in a patio. A medicine, or a medicine in a patio. That guideline, the manual will give you informations about. Okay? And there is no connection with any animals or human beings there. Or animal or human being no connection with the manual. Manual is all about, not manual, it's manual. Yeah. Manual. So there is no connection with animals or human beings, I can say. It's completely related to a certain kind of equipment, machine, or instrument or a medicine. Clear? Yes. What is a policy? What is the difference between policy and guideline? The random same or no? Not the same. So guideline, which means set of rules and regulations, those are your responsibility to follow it. Same like in policy, it is your responsibility. The only difference which I can see, guideline, which means it is from a particular organization or particular, in a medical context, yeah, maybe a hospital, from a hospital. But whereas policy, which means it's from the authority, from the government. Clear? And which lines are important in the second category? I can say the first 3 sentences are important. ആദ്യത്തെ 3 sentences എന്ന് പറയുന്നത് കുറച്ച് important ആണ്. I'm not saying you will get the exact answer from the first 3 sentences, but still I'm saying the first 3 sentences are important. I hope it is clear for you, right? Yes. And what are you reading for in the second category? എന്തിനു വേണ്ടിയാണ് നിങ്ങൾ second category വായിക്കുന്നത്? We are reading for the main idea. For example, I'm just reading about a particular microscope. ഞാനൊരു മൈക്രോസ്കോപ്പിനെ പറ്റിയാണ് വായിക്കുന്നത്. It's a manual. And I just want to know how this microscope is functioning. What is the speciality of this microscope? So likewise, I can collect main idea from this second category. Clear? That's it. And what is third category? In the category endana? Yes, a lot of comments. Definitely I'm just watching each and every comments here, but yeah. Okay, Fasila, policy instruction from a government or regulatory bodies. Very good, dear. Yes, Drishya, first 3 sentences are very important. Very good, dear. And what about the third category? In third category, we have 3 different documents there. The first one, the first one is a notice. Sorry, email. Second one, memo. And third one, notice. So why we are reading these 3 documents here, email, memo, notice, we are just reading these 3 to understand the purpose, the overall idea. For example, I am sending an email to my higher authority for leave application. So what is my purpose? And the purpose endana? Leave application. Enikku leave venam. So that is my purpose, right? So likewise, when you send email, memo or notice, you have a purpose. Or the sender have a purpose. And in email, memo, notice, there will be a sender and a receiver. Not in notice, but email and memo. And subject line is also important. Clear? And which lines are important in this three category? I can say the last lines are very important. എപ്പോഴും last lines നല്ല important ആയിരിക്കും. Clear? So that's all about three categories in part B. And if you guys are understanding all these categories properly, definitely you can score 6 out of 6. All right. Yes. Now, so the first step which I've told you, which is reading the question and underline the keywords from the question. So my keywords, already I've told you, it's memo, staff and vaccination. These are my keywords from the question. When you read a question from option B, part B, always connect with your option. നിങ്ങളുടെ ഓപ്ഷനോട് എപ്പോഴും കണക്ട് ചെയ്ത് വായിക്കുക. Otherwise it will be very confusing for you, very tricky. All right. Yes, Drishya, last lines are important. Yes, memo and notice. Yeah. Yes, Beulah, last lines are important. Very good here. So option A, staff requiring a free flu vaccination must have it done on site. So my keyword from options, have, done, site. Option B, staff requiring a flu vaccination must respond electronically. So my keyword is respond, or you can underline electronically. Staff requiring a free flu vaccination must be above a certain age. So above certain age. So these are my keywords from these three options. And the very next step is read the paragraph. നിങ്ങൾ paragraph വായിക്കുക. Also you can underline keywords from the paragraph as well. So the paragraph, memo to all hospital staff. And one more important thing you have to remember is that when you read the paragraph along with the reading, you should eliminate. Okay, വായിച്ച് കഴിഞ്ഞിട്ട് ഞാൻ eliminate ചെയ്യും. There is no time for that. So do one thing. When you read, along with reading, you should eliminate your options and just mention, okay, why I'm eliminating this. And when you get the correct answer, you can bubble the letter. നിങ്ങൾ ആ letter മാത്രം bubble ചെയ്യുക. Okay, and you can rub it off. Rub off any other writings or anything on that particular area. Just do bubble the letter. So I'm coming to this paragraph. Yes. Hi Ezekiel, good evening. How are you after a long time? Yes, Megha. Yes, Ashley, good evening. Yes, Monita, good evening. Anyway, memo to all hospital staff. To all hospital staff. So who is the sender? We have no idea who is the sender, but receiver, it is all the staff. Maybe it's a memo from the authority. The staff influenza vaccination program helps the hospital to keep running effectively during a flu outbreak when we are particularly busy. The offer of a free of charge quadrivalent flu vaccine to all staff has been extended. The following arrangements have been put in place in order to maximize uptake. So the first one, mass vaccination clinics have now ended. Please contact occupational health to arrange an appointment. An online form which has been sent to your email box must be completed and submitted beforehand. This will generate a reference number which must be noted and brought to your appointment. So what is the first thing if it is ended? The clinics will ended, vaccination clinics have now ended. So you can just send or contact occupational health to arrange an appointment. And for the online form, you can do one thing in this email and it should be completed and submitted beforehand. Then, staff working in community settings or who are unable to attend an appointment due to shift rotations should contact peer immunization. If you have any, if you guys are busy or something, you can just contact someone else. Then, the above information applies to staff aged 18 and over only. 18 വയസ്സിന് മുകളിലുള്ളവർക്കാണ് the above information is applicable. And for the rest of it, those who are 17 or younger may only receive the vaccine from occupational health and will be granted time off shift to do so. So 18 years over ആയിട്ടുള്ളവർക്ക് they can apply, they can do as per the information above. And if you're 17 years younger, less than 17 years, then you can do one thing എന്താണ്, you can consult occupational health and will be granted time off shift to do so. And what is the last thing? Staff may also attend a community or high street pharmacy to get the flu vaccination or vaccine privately. There will, however, be a charge which cannot be reimbursed by the hospital. So, ഇവർ പറയുന്ന whatever they've mentioned, you can just contact them and take a free vaccination. ഇപ്പം ഇങ്ങനെയൊക്കെ ആണെങ്കിൽ free vaccinations കിട്ടും. അതല്ല, if you're not doing so, you can take the vaccination from എങ്ങനെയാ പ്രൈവറ്റായിട്ട് നിങ്ങൾക്ക് വാക്സിൻ എടുക്കാം. ബട്ട് എന്താണ്, യു വിൽ നോട്ട് ഗെറ്റ് ദ റീഇംബേഴ്സ്മെൻറ്റ്, യു വിൽ ഹാവ് ടു പേ ഫോർ ദാറ്റ്. അത് ഫ്രീ അല്ല. ക്ലിയർ? ദെൻ സോ വാട്ട് ആർ ദ ഓപ്ഷൻസ് ഹിയർ? ഹാവ് ഇറ്റ് ഡൺ ഓൺ സൈറ്റ്. യെസ്. So maybe option A, respond electronically. So this is the question. Staff requiring a free flu vaccination must respond electronically. Simply you can eliminate this option because opposite or contradictory to the question. You have to respond electronically. എന്തിനാണ് electronically respond ചെയ്യുന്നത്? There is no response mentioned here. So whether you can eliminate because of opposite option or contradictory option, or you can simply say nothing mentioned about response. നിങ്ങൾ റെസ്പോണ്ട് ചെയ്യണം എന്നല്ല പറയുന്നത്. ഇഫ് യു നോട്ട് ടേക്കിംഗ് ദ വാക്സിനേഷൻ യു ക്യാൻ ജസ്റ്റ് സെൻഡ് എൻ ഇമെയിൽ ഓർ അപ്പോയിൻമെൻറ്റ്. റെസ്പോണ്ട് ചെയ്യണം എന്നവർ പറഞ്ഞിട്ടില്ല. നോ റെസ്പോൺസ് മെൻഷൻ ഹിയർ. ആൻഡ് വാട്ട് അബൌട്ട് ഓപ്ഷൻ സി, ബി എബവ് എ സർട്ടൻ ഏജ്. നിർബന്ധമായിട്ടും നിങ്ങൾക്ക് ഒരു ഏജ് കൂടുതലായിരിക്കണം. ദർ ഇസ് നോ സച്ച് കൈൻഡ് ഓഫ് compulsory element is mentioned. If you are 18 years more, you can just consult them. If you are less than that, you can consult others. So again, opposite or contradictory option. So simply answer is option A. Have it done on site. Have it done on site, which means from the last point, yeah, you can take vaccinations as per the previous guidelines. I mean the previous informations. Otherwise, you can take the vaccinations privately, but you will not get any reimbursement from the hospital. Reimbursement എന്ന് പറഞ്ഞാൽ giving the money back, returning the money back. Okay, അപ്പം അത് ഫ്രീ ആയിരിക്കത്തില്ല. It will be paid. That's it. So answer is option A. Clear? Yes. So that's all about part B. So now we are just moving to part A. So before that, let me know in the comment box how many of you got the correct answer. എത്ര പേർക്ക് correct answer കിട്ടിയെന്ന് കമൻറ്റ് ചെയ്യാമോ? Hi Ganga, good evening. Yes, I missed a lot of comments, but yeah, I'm so sorry for that because I was just, randomly discussing something very seriously, so I just forgot to, look into your comments. But yes, I'm so happy that you guys are well participating. See, as you guys know, we have offline classes here. So if you have any doubts regarding our offline sessions, you can contact this number given below on the screen. As well as if you need online classes as well, you can contact the number here. Clear? Yes. Yeah. So no correct answers. Argun correct answer kittila? Anyway, it's okay. So I'm just moving to the material which we have today for part A. So we have a self-prepared material for part A today. And as I informed earlier, I'll show you what is skimming and scanning method and how you can identify the answers correctly. So please do listen properly. And in the comment box, please do comment your answers as well. Ningoda answers kuda on the comment cheya. So see, this is a virtual classroom, right? It's a virtual classroom aanalle. So definitely the only way which I can communicate with you is only through your comments. Ningoda comments variyana enikku ningalote communicate cheyan pattullu. That's why I'm talking about offline and online classes. If you need those classes, please do contact this number below. Otherwise, as you know, this is a virtual classroom, so the only way which I can communicate with you is only through your comments. So please do comment so that I can respond to your comments. Clear? Yes. So esophagogastric balloon tamponade tube. So it's a very lengthy topic, but yeah, that's the topic. I'm gonna skim and scan. So please do listen properly. The esophagogastric balloon tamponade tube is used to control bleeding from esophageal and gastric varices. The veins in your esophagus and stomach lining and swell up when you have blood flow problems. The most common cause of these varices in liver cirrhosis or scarring. As scars form, the blood vessels are squeezed and blocked off. This leads to high blood pressure in the vein between your liver and your digestive organs. So this is how I'm skimming. And when you see what is scanning, which means within these two important, these are not paragraphs, points, when I scanned, I can underline important words. ഞാനിത് വായിച്ചപ്പോൾ I know that okay, these are the important words which I need to underline. ഇതൊക്കെയാണ് ഞാൻ underline ചെയ്യേണ്ടത് because I know these words will help me to find out my correct answer. Clear? And I'll give you 13 keyword strategy for that. So first one, you can underline all the headings, but I think I'm just doing something, so let me complete it and I'll tell you what are the 13 keyword strategy. Clear? Yes. Okay, so the pressure in your stomach and esophagus blood vessels also rises and leads to varices, swollen veins. This can cause life-threatening bleeding. Bleeding can also be caused by sores or ulcers in the lining of your esophagus, gastric band erosion, complication gastric banding, a tear in your lower esophagus called Mallory Weiss tear, a tumor. Your doctor will use other methods first to try and stop bleeding, like medications, injections into your veins or ligation, or tie off a varix. If they don't work, they will use a esophagogastric balloon tamponade tube. So that's all about my keywords from text A. Then text B. Before they place the tube, oh my god, something has happened in between. I'm so sorry for that. Anyway, before they place the tube, your doctor will give you a local anesthetic, insert the breathing tube and drain your stomach. Esophagogastric balloon tamponade tube is usually inserted through your mouth, although sometimes it can be done through your nose. Once it is in your stomach, your doctor will inflate the tube in some air and then take an X-ray scan to make sure that it is the right place. Once esophagogastric balloon tamponade tube is inflated, they will apply a weight to the tube for traction. This makes the tube stretch a little. The inflation combined with the weight puts pressure on the blood vessels and helps stop your bleeding. They will use a gastric suction pot to pull out any fluids and check for blood under the balloon. And the esophagus esophagus balloon will be inflated in the same way to stop any bleeding in your esophagus. Once the bleeding is controlled, the balloons will slowly be deflated every 3 hours until bleeding stays stable with low air in the balloon. The tube will usually only be in a place for 24 hours, and your doctor will use other methods to fix the bleeding. Those are my keywords from text B. Then text C, 512 or 512. Patients with variceal hemorrhage on endoscopy from October 2010 to October 2015. Then 446, exclusion, successful homeostasis by endoscopy. 66, rescue therapy by SB tube. Then first one is 33 patients received endoscopy before SB tube insertion, and 33 patients could not receive endoscopy before SB tube insertion but received endoscopy after SB tube removal. Then 50, success of bleeding control. 16, failure of bleeding control. 30, no rebleeding. 11, rebleeding. 2 tips. 33, survival. 6, death. 33, survival. 6, death. 16, death. 1 tip. So this is my keyword. And as you guys know, out of this 4 text, 1 text will be a pictorial of something. In the pictorial, maybe a chart will be there, or a graph will be there, or a diagram will be there. Whatever it is a pictorial. It will be a pictorial. And text D is all about predicaments, complications. Aspiration is probably the most frequent major complication of esophagogastric balloon tamponade tube placement. The greatest risk of aspiration occurs during insertion. The risk of aspiration can be minimized by evacuating the stomach prior to tube placement and maintaining a low threshold for endotracheal intubation. Asphyxiation is caused by proximal migration of the tube can be prevented with endotracheal intubation. If tube migration results in airway obstruction, cutting across all the tube lumens just distal to the point of bifurcation allows immediate extraction of the entire tube. Esophageal perforation or rupture can also occur with inflation of a gastric balloon that is inadvertently placed in the esophagus, or can be secondary or esophageal mucosal necrosis that results from excessive or prolonged inflammation of the esophageal balloon. Then pharyngeal and gastroesophageal erosions and ulcers caused by local pressure effects. These are my keywords from text D. So this is how you should skim and scan, and after that just collect an overall idea about text A, B, C and D. Then move to your questions. Okay, ini nammal question like poa. And before that I'll give you what are the 13 keywords that you can apply when you do skimming and scanning. The first one, you can underline all the headings. Ella headings underline cheyanam. Definitely they will ask you questions from the heading. Second one, you can underline all the subheadings. Ella subheadings underline chedu pova. And third one, underline all the numbers. Maybe numbers will be mentioned in figures as well as in words. So whatever numbers they have mentioned in the paragraphs, you can underline all the numbers. And fourth one, all the signs and symbols. Maybe less than is mentioned there, percentage is mentioned there. So whatever signs and symbols they have mentioned, mark all the signs and symbols. And fifth one, all the names. Maybe put ഒരാളുടെ പേരായിരിക്കും, or maybe name of a country, name of a disease condition. So whatever names they have mentioned, mark all the names. Then sixth one is abbreviation. Abbreviation എന്ന് പറഞ്ഞാൽ എന്താണ്? Short forms. And sixth one, all the brackets. എല്ലാ ബ്രാക്കറ്റും ഇമ്പോർട്ടൻ്റ് ആണ്. Definitely you can expect a question from the brackets. And eighth one, bold and italicized words. And ninth one, the words which indicate time. സമയം കാണിക്കുന്ന വർക്കുകളെല്ലാം അണ്ടർലൈൻ ചെയ്യുക, because in short answer questions definitely they will ask you questions regarding time. And 10th one, the words which indicate experiment related ആയിട്ടുള്ള വേർഡ്സ് ഒക്കെ അണ്ടർലൈൻ ചെയ്ത് പോവുക. Okay, like എന്തൊക്കെ എക്സ്പെരിമെൻ്റ്, ഡയഗ്നോസിസ്, പ്രൊസീജിയർ, ഒബ്സർവേഷൻ, ക്ലിനിക്കൽ. സോ ലൈക്ക്വൈസ് അങ്ങനത്തെ വേർഡ്സ് ഒക്കെ അണ്ടർലൈൻ ചെയ്ത് പോവാം. ആൻഡ് ഓൾ ദ വേർഡ്സ് ദാറ്റ് ഇൻഡിക്കേറ്റ് റിസർച്ച് റിലേറ്റഡ് വേർഡ്സ്, സ്റ്റഡി, ഔട്ട്കം, പോപ്പുലേഷൻസ്, പിന്നെന്താ ലൈക്ക്വൈസ് റിസൾട്ട്, പിന്നെന്തൊക്കെയാണ് അങ്ങനത്തെ വേർഡ്സ് ഒക്കെ. ഇപ്പം സ്റ്റഡി ആയിട്ട് റിലേറ്റ് ചെയ്ത് നിൽക്കുന്ന എന്ത് വേർഡാണോ നിങ്ങൾ കാണുന്നത്, യു ക്യാൻ അണ്ടർലൈൻ ഓൾ ദോസ് വേർഡ്സ്. ദെൻ the first and last line of each and every paragraph, and you can expect a majority of questions from the first and last line, as well as all the bullet points. Ella bullet points important aanu, and do remember whatever bullet points they have mentioned in a particular text, definitely you can expect a lot of questions from there. Avada ninge orupaadu questions expect cheyam. Okay, so that's it. First question. So yes, please be active and tell me what are your answers here. First one, rationale behind exerting force on the tube after inflation. So my keywords from the question: rationale, reason, exerting, and I'm not underlining after. Yeah, I do underline force. Yes, so reason, exerting force. So where they've mentioned about some reasons to exert force on the tube, ആ ട്യൂബ് നമ്മൾ ഇൻസേർട്ട് ചെയ്യുന്ന സമയത്ത് അല്ലെങ്കിൽ ഇൻഫ്ലേഷൻ്റെ സമയത്ത് ഫോഴ്സ് എക്സേർട്ട് ചെയ്യുന്നു എവിടെ കൊടുത്തിരിക്കുന്നത്. ആൻഡ് ഐ ഡു റിമെമ്പർ ഇൻ ടെക്സ്റ്റ് ബി ഐ ഹവ് സീൻ ദോസ് വേർഡ്സ് ദെയർ ഇൻ സെക്കൻഡ് പാരഗ്രാഫ് ഹിയർ. സി, യുവർ ഡോക്ടർ വിൽ ഇൻഫ്ലേറ്റ് ദ ട്യൂബ് വിത്ത് സം എയർ ആൻഡ് ദെൻ ടേക്ക് എൻ എക്സ്റേ സ്കാൻ ടു മേക്ക് ഷുവർ ഇറ്റ്സ് ദ റൈറ്റ് പ്ലേസ്. And once the esophagogastric balloon tamponade tube is inflated, so my keyword, they will apply a weight, so that means a force, to the tube for traction. So see, the keywords are here. So I got this answer from here, so that my answer is B. So when you get the correct answer, do just write that letter there. That's it. So 1 to 7 set of questions endana, it's match the following. Just write the letter there. Let me know in the comment box your answers, please. Yes, Monida. Yes, Beulah. What about others? What is your answer for question number 1? Yes, and let me know one thing. Any students or any student is attending this live session for the first time, ആദ്യമായിട്ട് എൻ്റെ ലൈവ് കാണുന്നു എന്ന് പറയുന്ന ആരെങ്കിലും ഉണ്ടോ? No. Okay. Yeah. So what is the correct answer here? Answer is B. Yes, Beulah, Monita, very good. Right answers. Yeah. So second one. In what circumstances does the greatest risk of inhaling occur? So my keywords: circumstances, greatest risk inhaling. So circumstances, risk inhaling. Yeah. What about second one, Anu? Yes, Anu, very good. First one is B. What about second question, Anu? Circumstances, risk inhaling. Let me know in the comment box. What about second question? What about second question? What about the second question? Circumstances, risk, and inhaling. No idea, right? Okay. So I got this answer from text D. Very good, Mega. Excellent. It is mentioned in text D. As you can see here, first para. See the first line. Aspiration is probably the most frequent major complication of esophagogastric balloon tamponade tube placement, and the greatest risk of aspiration occurs during insertion. See, what is the greatest risk here, major complication here? That is mentioned in text D. So that answer is mentioned in text D. So now we have a lot of comments here. Very good anyway. Yes, Monida, Anju, Ganga, Megha. Very good. Answer is mentioned in text D. Yes or no? Excellent dear. Third one, successful cases of bleeding control reported with esophagogastric balloon tamponade tube. So successful bleeding reported. Yeah. What about third one? Let me know in the comment box. What about question number 3? question number 3. What about third one? And third question, I can show you the third question here in this particular box. Okay, so here in the box, very clearly they have mentioned, see, 50 success of bleeding control. Etra perana control? 50 success of bleeding control. Exactly, answer is mentioned in text C. So answer is C. Yes, Ganga and Megha, answer is mentioned in text C. And fourth one, what diverse factors contribute to the occurrence of hemorrhage? So diverse and factors, hemorrhage. Or you can underline factors, occurrence, hemorrhage. Whatever it is, you can underline 3 keywords. Yeah. So what about fourth one? Yes, Sudha, Monita, Anu, Anju. It's mentioned in text C, the previous question. What about fourth one? Yes, Jithin. It is C. Yeah. So what about fourth question, guys? Yes, Jolie. Yeah. C. And fourth question. Very good, Ganga. You got the correct answer. Answer is mentioned in text A. A is the correct answer. Diverse factors contribute to the occurrence of hemorrhage. And as you can see here, bleeding can also be caused by these different factors. So that is the question. What are the different factors it can cause bleeding? So answer is mentioned in text A. Fifth one. Yes, Ganga, Megha. Yes, Anu, which is mentioned in text A. Very good, Jolly. It is mentioned in text A. And fifth one, conditions precipitating the inflation of gastric balloon resulting in perforation. So conditions precipitating perforation. Where is it mentioned? Conditions precipitating inflation of the gastric balloon resulting in perforation. Perforation, which means one of the complication, right? Predicaments. Yeah. So where is it mentioned? Yes, Rose, Monita. That is from text A. Very good. And what about fifth question, guys? Fifth one, and that is mentioned in text D. Esophageal perforation or rupture can occur with inflation of gastric balloon that is inadvertently placed in the esophagus or can be secondary to esophageal mucosal necrosis. Answer is mentioned here. So that answer is D. D ആയിരിക്കും answer വരുന്നത്. Sixth one. Clinical scenarios advocated prior the utilization of a esophagogastric balloon tamponade tube. So clinical, then utilization as well as scenarios. These are my keywords from sixth question. So clinical scenarios na parayumbol endha avaru udeshikkunne? What do you make clinical scenarios mentioned? Maybe consulting a doctor or going to the hospital, maybe taking medications. So that is clinical scenario. Yeah. Where is sixth one mentioned? Yes, Monita. Fifth one is from text D. Yes, Anu, text D. And what about sixth one? Sixth one is mentioned here. As you can see, yes. Fifth one, which is mentioned in, sixth one is mentioned in text A. See the last para. Your doctor will use other methods first to try and stop bleeding, like medications, injections. See, those are clinical methods, right? Scenarios. So that very simply you can say answer is mentioned in text A. Ano? Adele. So answer is mentioned in text A. And what about the next one? Next question. Seventh one. Therapeutic approach employed for the minority presenting with variceal hemorrhage. So my keywords, therapeutic and minority variceal hemorrhage. And I have seen this variceal in 2 different texts. I think in text C as well as in text B. But I think this answer is clearly mentioned in text C. Yes. 66 rescue therapy by SB tube, right? So that answer is, yeah, therapeutic approach employed for the minority presenting variceal hemorrhage. So that answer can be taken from that one. So that is C, text C. Not A, dear Ganga, it's not text A, it's from text C. So C is the correct answer. Okay, so that's it. That's all about that. So anyone with 7 out of 7? 7 out of 7 kittiyarengilundo? No, right? So likewise you can find answers for rest of the questions 8 to 20. Clear? So do find out your answers and do check your answers whether it is correct or not. So I'm just winding up today because I've discussed a lot of things regarding your exam and what are the tips and tricks that you need for your exam regarding Part A and Part B, as well as So please do write your exams properly. Please do continue your preparations correctly. Clear. So I see you on Monday. Anyway, all the very best, guys. Do and attend your exam properly. So thank you. Take care.